One of the most common comment which I get in my clinic is, Doc, I have a thyroid problem and now I want to start a pregnancy. So please give me few tips so that I conceive fast. Well, is that a question in your mind too? If yes, then stay tuned with me because we are going to discuss that in our today's topic. Namaste. My name is Dr. Tanvi Mayur Patel. I am an endocrinologist, hormone specialist doctor from Mumbai, India. Now before I continue this video, one important information. If you want to watch this video in Hindi language, then below in the description box there is a link. If you click there, this video will be played in Hindi language for you. अगर आप आज के इस वीडियो को हिंदी भाषा में देखना चाहते हैं तो नीचे डिस्क्रिप्शन बॉक्स में एक लिंक है. अगर आप उस लिंक पे क्लिक करेंगे तो इस वीडियो को आप हिंदी भाषा में पाएंगे. So let's continue our today's topic. See, thyroid problem is one of the most common endocrine health problem. And most of the time thyroid problem happens more commonly to women. And because of that, when we talk about the conceiving and a family planning, this problem of a thyroid usually comes in the way. So how we can tackle this problem and conceive? That's a very commonly asked question in the clinic. See, we all, especially in the metro cities, people are getting married at a later age. And once they get married, they're still in the honeymoon phase. They want to know each other. They want to know the family. And that's why they want to delay the pregnancy. Many times, the women are also career oriented and they have their finances also to be met. And keeping all these parameters in mind, usually the couples delay the pregnancy. But once the outside pressure starts falling into place, when the biological age is tickling over, the family is, you need to complete it. You have your finances arranged, your career is set, and that's where a couple decides to start a pregnancy and a family. But what is in your mind? Your body may not respond to your mind, and it might happen that delay can happen. See, Mother Nature has its own way of conceiving. And that's where, when you don't achieve your target in your time, the couple becomes restless and they start wondering here and there what to do, and they want the quick fixes. So those quick fixes which are scientific and which can actually help you is that we are going to discuss today. See, understand, for a healthy couple, it takes nearly 6 to 12 months without any kind of a protection, and when you are indulging into regular physical intimate contact, you have a chances of conceiving. Nearly 85% of the women conceive after 1 year of trying. So if you are planning for a pregnancy and if you are not able to reach your target maybe in a month or two, please do not get disheartened and work up more on the tips. So talking about the tips, what is the first tip which I want to tell you? And that is get a preconception checkup done. Yes. Why is this important? See, due to the urbanization, the women are delaying their pregnancy, and that as you grow older, your chances of having a many health problems is more frequent. So you have to have a preconception check. Secondly, when we talk about the thyroid, as I told you earlier, that thyroid is one of the most common endocrine health problem, and if you do not tackle it carefully, it can give you the infertility. But the good news is that the thyroid problem is the most easiest and the best way to control. And in fact, once you control your thyroid imbalances, chances that you conceive becomes nearly similar to the person who do not have a thyroid problem. So first thing first, get your preconception check, get your thyroid function test. And if you already have a thyroid problem, do not get disheartened. Just focus on controlling your thyroid to the optimum level. And when you are planning for the pregnancy, make sure that you do not stop your thyroid medication. it might be possible that you might need a revision of your prescription. So go and visit your thyroid specialist doctor immediately. And if you do not have a thyroid problem, and if you have any family history of a thyroid problem, or if you have any other health issues, or if you have any other autoimmune health problem, again it is very important that you get your thyroid testing done along with the antibodies level to check whether do you have any kind of a borderline thyroid, what we call it as a subclinical hypothyroidism. It is found that many of the times when you treat these conditions, your chances of conceiving increases. So first thing first, get a preconception thyroid blood test analysis. Thyroid is not the only reason which can give you the infertility issue. So second important tip is that you find out for any other health problems like anemia. See, anemia is again a very common problem we encounter in a country like India. Again, when you have a thyroid problem, many of the times the women have a heavy menstrual periods, and that can cause a lot of blood loss, and that can cause anemia. So make sure that if you have anemia or not, you find out. Many of the time what happens, especially when your thyroid is not in check properly, there is an imbalance of the prolactin hormone also, and this can create an issue in the ovulation. So make sure that your prolactin is correct. Especially if you are 35 plus, then make sure that you check your AMH hormone level, because if that is also on a lower side, you will have a difficulty in conceiving. So make a note of that. Many of the time what happens, PCOS is another hormonal problem which many times coexist with the thyroid problem. So if you have a PCOS problem, again your ovulation is impaired. And PCOS will also increases the insulin level, and these causes a lot of imbalance of your hormones, and which is not a right room for a fertility. So make sure that when you do the preconception analysis, you do all this testing, visit to your nearby doctor, inform your doctor that you are planning for a pregnancy. So whatever needs to be done can be done. Again, a very important thing is the sonography. Yes, get an ultrasound done of your pelvis area. When we do the ultrasound, we actually want to see what is the status of your ovary. We see what is the status of your fallopian tube, your status of the uterus. So these are again a very important areas when we talk about the fertility. So get this preconception analysis. Second tip is that take a prenatal vitamins. Yes, the prenatal vitamins like a folic acid. Again, it is found that if you take a folic acid in a right proportion, you are preventing from plenty many birth defects which can happen to your unborn child. So make sure that you have sufficient amount of the folic acid, vitamin C, zinc, vitamin D, then a vitamin B complex. All of these has to be replenished. Okay, so this is about the preconception analysis and preconception vitamins. Now certain healthy habits which you need to start. See, you are planning for a pregnancy, you are planning for a new life in your body. So when you want that new life to come inside you, you also have to begin your life in a new way. And for that you might have to get rid of many of your older unhealthy habits. Habits like overconsumption of caffeine, then smoking. Yes, the smoking is again becoming very common among women, and when a woman who has a higher chances of smoking, their estrogen level is imbalanced, they have a difficulty in conceiving. If at all they conceive, they have a higher chances of miscarriages or a premature delivery. The children might have some smoking related birth issues or even an underweight child. So first thing, you have to cut down on your smoking. You also have to cut down on any kind of a recreational drug usage or a excess consumption of alcohol. So these are the healthy habits. Now another thing is that the weight management. Yes, weight management is also very important, especially people who have a thyroid problem. They have a weight issues. So if you manage your weight properly, this is not only going to increase your chance of pregnancy, but also it will reduce your possibility of getting a gestational diabetes, which exclusively happens during pregnancy. Again, during pregnancy, if you are already overweight or obese, then you conceive, you will further gain weight during pregnancy. Again, it will become difficult for you to lose weight after the delivery. So make sure that you maintain your weight in a healthy BMI of around 25 to 27. Another tip is the exercise. Yes, if you are not doing exercise, start doing some form of a physical activity, because the more the exercise you will do, you have a higher chances of having a better ovulation, and that will increase your pregnancy chance. But again, when you do exercise, don't overdo it, because if you overdo exercise, these women do not ovulate properly, and that can be an issue. So moderate exercise 5 times in a week is sufficient enough. Alright. Another tip is your diet. Yes, avoid any kind of a processed food or a junk food. The food which is usually comes in the packet or the ready to eat, or processed food which you get it from the restaurants, try to avoid that and switch over to a healthy home based balanced meal. So these are important tips. Another thing is that you need to know your menstrual cycle very well. Yes, see why it is important. Because if you know your cycle well, you can plan your pregnancy properly. See, in a normal woman, the monthly cycle is of around 28 days. However, there is a plus or minus 7 days variation. That means a cycle of 21 to 35 days is considered normal. And usually in a 28-day healthy cycle, a woman ovulate on the mid of the cycle, that is 14th day. What is a ovulation? See, ovulation is nothing but a process by which your body is releasing one egg. Yes, usually every month one egg is released. And this one egg which you have, if that egg gets fertilized, you are going to get pregnant. Isn't it? It's as simple as that. So you are actually wanting of that one egg. So when is that one egg going to release? That's nothing but the ovulation. As I told you, it happens in the mid of the cycle. So it's very important for you to note down your cycle. Yes, please make a calendar and make a note of it, whether you are having a regular cycle or whether you are having an irregular cycle. What is the duration of your cycle? If you know your duration of the cycle, try to focus on the midweek. The problem happens when you have an irregular cycle, either due to thyroid which is not controlled properly, or if you have a coexisting PCOS. Only in that kind of a situation, cycles are irregular and it becomes difficult for a woman to know their ovulation. In that kind of a situation, you can take a help of a ovulation kit also. By the way, what is ovulation kit and all, I have made another video for that. You can watch that, so you will have a detailed knowledge about it. So you need to focus on your ovulation, and once you are clear about your ovulation, that is a time which you need to plan your intimate contact with your partner. So if you are not sure of your ovulation, in that kind of a situation, we always tell a couple that you must maintain a physical and an intimate contact during the middle 2 weeks. Yes. So between that 11th to 21 days is the time when you should have a maximum intimate contact, and that is how you will increase your chance of conceiving. Now, certain tips in terms of the physical intimate contact. The first tip is, what kind of position is considered better? See, there is no such position which is going to increase your chance of conceiving. However, missionary position is considered better compared to all the other position. Again, try to avoid any kind of gravity defined position like sitting or a standing. See, the whole idea is that once you have a semen inside your body, you want it to stay, and if you are going to stand or a sit, in a gravitational force will pull it down. So to avoid that, avoid such kind of a body position. Again, a commonly asked question, is there a need for a woman to lie on a bed for a while? See, if you lie down for at least 5 to 15 minutes, again the gravity will do its work and a semen can very easily travel. For that reason, yes, you can lie down in the bed. However, there is no need of lifting your leg in the air. Another question is how frequently you need to have an intimate contact. See, there is no such evidence that if you have a multiple times in a day, then your chances of conceiving increases. See, understand that the life of a sperm inside the semen, once it is ejaculated and present in a woman's body, can even last up to 3 to 5 days. So that is a life of a sperm. So it is not necessary that you have to have multiple times in a day, but yes, if possible, try to have a physical intimate contact on a daily basis or at least on an alternate day. Now talking about the men's health. Yes, again a very important. Most of the time what happens when a couple is trying to conceive, all the attention goes on a woman and they don't pay attention to the men. That's not right, because conceiving is a couple's job. So if you are having any difficulty, you have to look into both the partners. Similarly, when you're planning for the pregnancy, you need to focus on health of both the partners. So male partner health is also very important. So before you start conceiving or plan for the conceiving, always get a semen analysis done. And once you have a semen analysis in check, you will be able to know what is the sperm count, what is the motility of the sperm. So these are very important aspect and mainly neglected. So that has to be paid attention. Secondly, many of the time even a man has a thyroid problem. So if you have a thyroid problem, again you need to make sure that it is in check. Otherwise it will become difficult for you to father a child. So certain general health tips which applies to women also applies to the men, that you need to cut down on your stress, make sure that your sleep is regularized, make sure your body weight is in check, you are doing a regular exercise, avoid any kind of a smoking, alcohol, excess of a caffeine or recreational drug usage. And if you are a man and if you are trying to consume lot of soya products, cut down on that, because soya products has some amount of the estrogenic component, so try to reduce that. Another thing is that try to avoid using a very hot water shower or wearing a too tight underwears or going to sauna. Okay, this you can try to avoid. Many people also have a habit of putting the laptop over their lap. So if you have that habit, or if you have a habit of putting a mobile phone near your pockets, again try to avoid them as much as you can, because there are certain radiations which can affect the fertility. Again, when you talk about the usage of the undergarments, try to wear loose boxers rather than wearing a too tight briefs. So all these certain tips which you can keep in mind when you are planning for a pregnancy. See, as I told you earlier, that if you plan right, your body will respond to it and your body will definitely react positively. A positive mindset is very important. Understand that it takes time for your body to accept those new changes. So if you are going to do these new changes, you have to give some time for your body to react and respond to it. And once your body is internally mature and ready for the conceiving, it will definitely conceive. Nearly 85% of the couples, they achieve pregnancy within 1 year of a trying. So in spite of 1 year of trying and a repetitively unprotected kind of a sexual activity if you are doing, and if you are not able to conceive, it is a time for you to visit your nearby endocrinologist or a fertility expert doctor. Seek their medical attention. What if you do not know whether if you have any kind of a problem or not? And if there is a problem, don't get disheartened. Today's technology and the medical science is very much advanced, and we have a solution for most of the health problem. All right, I hope these tips have helped you, and I wish you a very good luck in your family planning. Thank you for joining me till now. I hope these tips will help you and you will receive a beautiful bundle of joy in your family. If you are new to my channel, don't forget to subscribe so that you get more and more health related information. And if you have any of your personal question whose answer you are seeking for, please write your question in the comment box. I try to read them and answer them as early as I can. We will meet again with some new good interesting topic. Till then, take care of yourself. Namaste.